about 2 years now, Care International in Uganda has been working towards restoring hope and lives for communities in northern Uganda. Emerging from decades of war and internal displacement, communities here are now enjoying a new wave of peace that has made it possible for organizations like CARE to intervene in ways like the Roco Kwo program. The program targets different facets of community interventions aimed at providing a holistic approach to human development, socially and economically.
The Roco Kwo program has evolved over the years from a number of discrete projects into what we now describe as a program. It's supported by Care Norway donations, or donations through Care Norway, and also through Care Austria using Austrian Development Agency funding. And then we also have some other smaller supplementary funding. This program, as we call it now, is designed to work with particularly the poorest and most vulnerable segments of the population in that area. And women and girls are those that we've identified as being the most vulnerable. And strategically within Care Uganda, this support to women and girls we've identified as a key issue.
We consulted with the community and they gave us a name, Roco Kwo, which means transforming lives. So we started having discussions with different people. We went through a process of analysis and understanding how these different components can come together and be delivered as one program. So we have gone through that process. We have now a long-term strategy, a 15-year strategy, to work with women and girls affected by conflict.
The Roco Kwo program targets improving people's economic livelihoods by using a unique approach that encourages communities to save together and then use their savings as capital for the development needs. With CARE's support and training, communities formed what is referred to as village saving groups. Members in these groups are given skills and training in managing a basic microfinance system.
That money they are saving, they save, they give the loan, and they pay back the loan with the interest of 10%. So that money they use for just a petty trade, because when it is time, when you get the loan, you stay with the loan for 1 month, then you repay the money with the interest. Their interest is 10%, as I said. So when you borrow, they ask you, what are you going to do with that money? So you have to tell them, I'm going to buy this thing, I'm going to sell it where. Because you cannot borrow and you use it anyhow. There's a rule for it also.
Pay captain away. Olo twal keri bilanya siene. Wiu poni. An mier ka nen kid gi mama ran wilene. Ma ngeti ni ram gwaka siene. Tia ne amalet. Kache mege mogo. Inoni mege muteki. Eto no ti boli chobi. Kono bogonyo boli chob no tiki kit ker moge ken. Timu gi moe kana wi twaro. Tia la bole kom an. An kumbela ti ana data ma ti ka pialo ti ano kich kumbela da abolo bole cho mwaka ngwen na da ti ye eni mwaka ngwen na bolo ni kumbela ti ki bia cha na ma ti ye ati bia cha me rech awilo kumbelo pego na ti gang ma ti gwakone ma eni weng alwoni bia cha ma ti kere.
We've realized that these community members, with the little inputs that we've given them, some of them have already harvested and they have enough for their household food security, and this has been quite good to us. Looking into the Village Saving and Loan Association scheme, as of now, the community who are engaged in this have shared this loan scheme money, and as of now, some of them have bought some assets at their home. And to us, it is quite amazing to see a farmer or an impact group members from that effort buying another oxen pair This is quite tremendous. And if we see these very impact group members using this initiative, buying another asset in the form of a radio, in the form of a bicycle, in the form of a goat, that is quite amazing to us as development actors.
At the backbone of the saving groups are what are referred to as community impact group members, a core team of women selected and trained in their communities.
These women also, we use them as agents of change because we always organize outreach services. We take these women to go and preach to others, involvement in governance issues. We use them to empower other women because like a woman in a VSL group being a chairperson is also heading 30 people, including men. So this woman feel bold enough to talk to others. Through this woman, others also get motivated, and next time you'll find them coming more to participate in the management position, not leaving to men. That's why you see these are women who have been entrusted, much as there are also men in the group, but there have been no problem at all with their management.
I've seen women and men testify and say, me and my wife, we are able to plan together and implement whatever we want to implement. And of course that one promotes kind of the livelihood security that we are talking about.
Ati group ma kilwoni chandek me, ati karan be group me chandek me. And dong mo be ngara ne dagona, ni akel Christian. Atamo be pa puon ma wano ke bot kaya. Ukelwa la ma duong art. Ukela la ma repeka chiele are. Ko mi la be puon ma pola de da. Wa no ni group kara be.
We've also provided the oxen. And we thought maybe this oxen would bring conflict, but this kind of grouping also, it tends to bring up people together, and during the interaction, the women and men share the challenges in their households, and there is counseling, there is peace building in those communities, in those groups. So I've seen the discussions go on, and some of the women testify that they've got counseling from other group members.
Meet Opio Robinson. Together with his family, they are farmers in Koch Lee Parish, Koch Goma Sub-County, Moya District in Northern Uganda. They, like most of the residents in this community, are members of the Care Intervention Group and have been receiving training with other members from the demonstration garden in this area. The Opio family is now enjoying big harvests and have managed to improve their food security as a result of the group training they received from Care's Intervention Demonstration Garden.
Specifically in this program, one of our strategy for promoting women's empowerment, among others, is to actively involve men as allies in promoting women's empowerment and gender equality. This comes from a new school of thought that actually not all men are against women's empowerment and gender equality issues. We really believe that among the men, we have a few who are supportive for this cause, and therefore we can actually engage with these few who are already supportive of this cause, and then partner and engage them as allies and build that kind of partnership with them so that they can have that kind of influential voice at community level.
Ikin la cho ki dago tit wa mier ki ti marom jem la cho ti mo dago bano tim ki wa tete gi gen ma miu ko bel ti ken dano wa wachi gi lok ma dore kom kan lok ma dore kom chato chamme ar eno ne jem ma kelo ko I ar ken la cho ki dago.
The successes of this project have largely relied on addressing the psychosocial aspects of mainly the women and young girls.
What we are proud of is seeing more women now engaging in group activities,
being able to work together. We are yet to measure their self-worth, their attitudes towards themselves. Are they able to come out and be able to contribute to their well-being, you know, positively or confidently? We are yet to measure that because this takes quite some time. But of course we have interventions that are geared towards that. We are happy that apparently they freely involve in group activities. They are able to join VSLA groups. So far, that is the achievement we can pause off, and also being able to seek support when they need support, which was not the case in the past.
Right now we are having a community dialogue. They are discussing the effect of sexual gender-based violence and the effects on their family and the community at large.
The issue which we have tried to handle in our community is domestic violence between a woman and a man in their family. So we tried that one in the position where we could help and stop it. When they have not yet gone further, we stop it.
These community dialogues also provide a platform for addressing many other social challenges like gender-based violence in homes. CARE and its partners are now using these spaces to communicate in more creative ways about addressing challenges like alcoholism and gender-based violence.
Initially, when we had just come to Lamoge sub-county, there was high rate of domestic violence amongst the people of Lamoge, and this was basically caused by a high level of alcoholism, whereby most of the household heads used to engage in drinking alcohol. So when we came in, we started using drama to sensitize the people on the dangers of domestic violence, and through using dramas, we have tried to reduce the rate of domestic violence because by acting, the community gets to know the advantages and disadvantages of domestic violence at home. And it has really helped ALPI, together with CARE, to cap down the rate of domestic violence at home.
By the time we started working around issues of gender-based violence and gender in Northern Uganda as early as 2005, it was very common, you know, evening to hear women crying out for support and maybe running away, having these divorces and the like. But I think there's a big difference. It's anecdotal, but at least people can say that there is a change. There's less fighting within the communities. And also I think today, when you talk to women in the communities, they will tell you that they know where they can be able to find support if an issue happened, or if they fought, or if they had a case of domestic violence or an abuse.
What happens is that because of the good political will and because of the existing civil society, they've gone ahead to supplement on the work of government to help at least the people at the grassroots to understand, to appreciate, and to call on the key duty bearers to actually implement, to do what they're supposed to do. And at the moment, I'm happy to note that actually there's been a lot of progress on that. There's reviewing of the police Form 3, that's what it's called, to make sure that there are other medical people, there are other health workers that can act, that are on the ground, that can examine the survivor on spot and give a report so that the person can actually have the required treatment prior.
Addressing aspects like gender-based violence comes in handy with the wider mandate of peace building for the communities here. For example, the resettlement program that saw a number of families returning home after several years in camps sparked off a number of land wrangles. The Roco Kwo program has a special provision of training community peace teams.
The peace teams have been very effective in resolving some of the conflicts. They were set up mainly to to bridge the gap between community members and the policy makers and other stakeholders like civil society organizations, because they are also, the members of the team are community members who identify advocacy issues and other challenges being faced within the community, and they forward to the relevant authorities. They don't only forward, but they also act on the emerging issues depending on their capacity.
We have peace team of 25 members, but here behind me here, you can see 3 of them. They are working in this village. They are very vital in solving conflict. Those people, really, they work very hard. As you have seen, we have land dispute. Our major problem in our land here is now land dispute. If you have seen, this house has been destroyed because those people cannot go and settle anywhere because they don't know their boundary. They destroy their houses. So those 3 in this village, they are the one who is resolving the conflict, talking to the LCs. If you have seen, that man is also an LC1, and he is also a member of peace team. So the work of the peace team made the work of the LC1 and LC2 very easy.
CARE's mission in restoring people's lives here is also in line with many other international resolutions like 1325 that aims at strengthening women, especially in post-war conflict situations. This is a mission that CARE cannot accomplish single-handedly and therefore works closely with many other partners.
When we went in partnership with CARE, this had added values to our work, because it has magnified what we had been doing to a certain levels that like in area of peace building that we have been doing in the United Nations, which talks about 1325 and 1820 and the Goma Declaration. 1820 talks about taking record and stock of cases of SGBV, that is sexual and gender-based violence, and reporting them. And the reporting does not stop at this level. It's from the LC's level, it goes up to the national level, and the national level has to account to the United Nations by giving the data and giving what they are doing to redress those issues of sexual gender-based violence. And this is where we are best, because it has given us opportunity to report on these girls that have been defiled, have been abducted, have been gone into early marriages before the time they should have gone to marriages, and has given us time also to caution the government on the protection, on the participation, on the involvement of women in peace building, and more especially on awareness raising on the rights of women.
It is a little early to assess and genuinely point out the impact of the program for now. It still has a long way to go until 2015. However, with what is being seen, there is hope that in the Roco Kwo program, many families in northern Uganda will be able to live the lives they've been dreaming of.
Challenge that I see, the need is big in the communities, and you know donor funding cannot reach everyone, and that is a very huge challenge which is already existing, but we shall do our best to see that the most affected are supported. Northern Uganda being a patriarchal society, it is very hard to promote women empowerment because the society has ideologies that promote men, and you find that women's rights are stepped on, and you find that most of the activities that we do are trying to promote this woman that has been a subordinate to a man, which is really very challenging, especially in the eyes of the men themselves, even the women, because the systems that are set are meant to put women under the men.
I think we are really optimistic that change is possible on the ground, that people can be uplifted from conditions of poverty and despair. We have seen that work. We have taken our time to try and understand the dynamics of poverty at the grassroots level. We have taken an approach that really focuses on specific groups of very poor and marginalized people.
The program is also in line with other national programs like the National Development Plan and the Peace Recovery and Development Plan for Northern Uganda. Both programs have a strong emphasis towards empowering women and men in many ways, but specifically ensuring that communities that are recovering from war and conflict are supported to overcome social, economic, and political challenges.
As I talk now, when you go to those who got this support in 2008, you find some of them has already 7, some 9 per household. So I think other than giving more, giving real goods, some other support should be given to boost. This is one part of agriculture. You're giving them livestock. Another thing maybe you also consider opening markets for them, creating them avenues through which they can go and sell these goods to support the soldier.
We are digging a trench, as you can see. It's supposed to be running for 7.5 kilometers. This is to stop the elephant from crossing. This is the spot at Ayago where there's a lot of elephant causing destruction to human properties and threatening life of people. So when you dig a trench like this, it would not be easy for the elephant to cross. It is going to improve the livelihood of the people within, but there's a lot of work to be done, that is sensitizing the local community to understand that it's very important to work together to protect this wildlife from crossing here.
Abero daga sien ma abino ka timo tich man wer olo ka che gin mama wa furi poro liech piko bal ti kumbere chane anda ri kan maromo chabira siel endo chene ma nodong beba anodong chene maromo chilinga lit mia siel ki piara ngwan wi abu ngwan ana luo mon lo wara ne kerne ngo bin wer olo go yele go tong bene vuni wa ole wa nong chana ke mi ario me gengo bene le maduong mai balo jeme iporwa.
The Roco Kwo program is therefore a timely intervention that is also complementing government programs.